Well, first of all, atrial fibrillation is very common. There are probably 3 million people in the United States with atrial fibrillation. The problem is that's associated with about a 5-fold increase in the risk of stroke. Good news is that blood thinners or anticoagulants will reduce that risk of stroke, probably by about 2/3. But it's generally indicated for lifelong treatment. So once we start a medication like this, patients are usually on it for the rest of their lives. So we have to think about the side effects of these medications in the long term. We looked at about 10,000 patients and were able to follow their kidney function over time and track which medications they were taking. This afforded us the opportunity to compare drugs to each other and look at the rate of kidney function decline over time. What we found was that at about 2 years, about a quarter of people had at least a 30% decline in their kidney function. This can be significant. It appears that all these drugs are not created equal in terms of the rate of kidney function decline over time. And for some of the newer drugs like rivaroxaban or dabigatran, we saw substantially less kidney function decline over our study period. But we didn't necessarily expect to find that. The clinical trials that examine these drugs are most interested in the rates of bleeding and the rate of stroke. And those are the primary outcomes that are reported. But taking a closer look at these data, we can start to see some of what we would consider off-target effects of these medications. Because kidney function decline is so common in this patient population, it's important to track that and see if there's any variability based on the drugs people are taking. Particularly for dabigatran and rivaroxaban, we saw substantially lower rates of kidney function decline in patients on those medications. I think this study has very important implications. First of all, kidney function decline is quite common. Second, if your kidney function were to decline, it probably increases your risk of both stroke and bleeding. Third, if your kidney function is declining, some patients may end up with severe or end-stage renal disease, some of whom may even require dialysis. I actually think that this study is quite good news for patients with atrial fibrillation. First of all, I want to stress that patients should continue to take their medicines. We know that they're very effective in reducing the risk of stroke, and patients not taking their medications is probably the biggest threat to ongoing risk of stroke in this population. Second, for so long, we only had one option, warfarin. It was cumbersome, and we know that kidney function decline is very common in this group. But perhaps the new drugs offer some benefit in terms of improved safety in that regard. The most important thing, of course, is that these drugs reduce the risk of stroke, and they all do that quite well. So ultimately, you have to make a choice, keeping in mind that the primary purpose of these drugs is to reduce the risk of stroke. But data like these, I think, shed some insight into the fact that some drugs may be better than others in these sort of unintended consequences. The downside, of course, is that these drugs are newer and that there is a considerable cost for many patients out of pocket. So ultimately, the decision has to be made between the patients and their physicians.